shouldn't want you, I shouldn't need you, but I'm afraid that...
Is there a concern with my transplant that I should be concerned about?
As we are all aware, a patient who suffers from hair loss, a patient who suffers from male pattern baldness, androgenic alopecia, comes to us not only for a physical ailment, a physical shortcoming, but also a problem that is affecting him to a great extent psychologically. So if a cosmetic surgery procedure like hair transplant is not only about the physicality, and it affects the psychology to as great an extent as it affects how you look, it affects your body image. So how can merely a hair transplant take care of a patient suffering from male pattern baldness, especially given the fact that male pattern baldness is ever progressing and the gene is going to continue to have effect on his hair loss and continue to affect him psychologically. So a deep conversation every now and then with the patient is of utmost importance. Conversations with the patient give a deep understanding of a patient's problems, not only in the physical sense, since psychology is as important. Meaningful conversations help also to strengthen the doctor-patient relationship. They are also essential for solving complex problems and are an opportunity to explore different solutions, weigh the pros and cons, and collaboratively work towards an effective solution. Moreover, a detailed conversation allows the patient to share his problems as well as his emotions, his deepest fears. This conversation fosters empathy as the doctor gains a deeper insight into the patient's feelings as well as the patient's perspective. And this is crucial in building trust. As in this patient who recently got a hair transplant done elsewhere, and within a month, he is seeking advice about his hair transplant elsewhere. You can very well see that there is no trust between him and the doctor. A little bit more time spent with the patient goes a long way in addressing his concerns. So watch this conversation. I'm sure you'll learn a lot from this video. So let me see your pictures again. When was the procedure done?
4 months, you can say around July. So it's 4 months done already, and 5th is already starting now.
So it's very difficult to say at this stage whether the result is coming out or not, because 4 months is the time when it just starts to grow. So if I can see that FUT procedure along with FUE procedure.
Yes, that's along with beard too.
Yeah, along with beard. Okay, body hair transplant as well.
Yes.
So we'll have to wait for at least 6 months before we can give an opinion, pass a judgment on a hair transplant. But right now it will not be very fair to say that the result is coming or not coming, because I can see hair growing up. The only concern seems to be your donor area is a little thin. That's all.
Yes,
Otherwise, I don't know, the doctor would know better. Or probably what has happened is that your donor area has suffered huge shock loss.
Yes, probably that too. And I'm not sure about if it's being over-harvested or not, but my donor area was already thin to begin with anyway, if you will see in my older pictures. So I'm still recovering on that. Plus,
so I think if we should wait for about 6 months after the procedure before giving any sort of opinion. It will not be very fair to give it now, because right now it's just the growing phase. This ugly duckling phase still going on. 4 months is the time when it just starts to grow. And I can see hair that is growing there in the front. Crown was not done?
Crown was also done. I have sent the pictures of that.
Yeah.
Crown was done, but it's sparsely. I was suggested that I could not have enough grafts on the crown, so I will have to do a bit of compromise there in the crowns area.
I got it.
Yes, that was the one. Okay, now questions I would like to have, sir. So I was put on Finasteride, 1 mg a day.
All right.
I was being told that it would be 3 months, 1 mg a day, and after that it will be alternate days, which was okay. Now, as all of the other patients, I was skeptical to take Finasteride, but okay, I have to bite the bullet anyway, somehow, one day or another. So I'm taking it fine. After 3 months, when I said to the doctor that I do not have any problem with Finasteride so far, I do not have any side effects, they suggested me to have it for 6 months for 1 mg a day, and then alternate days. That was 3rd month. Now, just as 4th month has passed, I have been suggested that I should stop Finasteride completely and switch to Dutasteride. I'm not very comfortable doing that, because I believe that Finasteride should be given at least 6 months, 8 months to see if it's working or not, because I believe it's working. I mean, a little bit of hair are there in the ground. And even if we introduce Dutasteride, it should be done gradually, as in adding one dose in a week and keeping the rest of finasteride and then moving on. So I would like to ask you about Dutasteride. That should I go on Dutasteride just like that, or should I wait for finasteride to work?
If we see your pre-operative picture of your scalp donor, so it is little thin. Don't you see? Don't you think? Even on the sides of the head above the ear, it is little thin.
Yes.
So was the baldness stabilized before going in for a hair transplant, or you started taking finasteride only after the hair transplant?
It was only after transplant. So what also happened that I was scheduled to have a day and I missed that day because I was sick. So they suggested me that since I've become better, I can take finasteride. So I did take finasteride a month before transplant, but not regularly. I was doing like twice a week. That's it. I was not taking any medications prior to my transplant.
So see, in cases of miniaturization in the scalp donor, which clearly your scalp donor has, you have to prepare the scalp donor with finasteride, because when these grafts are moved, then there is half a chance that many of them will not grow, because you cannot shift miniaturizing grafts and expect them to grow in a new location when they're not growing well in the donor area itself. It's the native area.
All right.
So you should have been prepared using finasteride, but still you can still have a result. It's too early to say anything. It's too early to pass a judgment. I think you should wait for 6 months and then see what it is. But you cannot do without finasteride in the long term. I believe you're only in the late 20s, so you'll have to take finasteride till about another 7-8 years.
That is fine. I am willing to take finasteride for a few years, but I was asking about Dutasteride. Should I just start Dutasteride?
So I'm talking about basically generically about DHT blockers, the requirement to take DHT blocker. Okay, as far as Dutasteride is concerned, Dutasteride is a very strong DHT blocker. It blocks almost 95% of your DHT, whereas finasteride blocks only about 73-75%. Every hormone that is being made by God has a function. We cannot forget that. If you block DHT to that extent, sometimes what happens is that the baldness, the thinning, the effect of DHT blocker goes away when we use such high doses. It's called reflex hyperandrogenicity. With that, the effect of DHT blocker goes away. Because the body is not stupid. It also responds to challenges in its own diverse ways. So Dutasteride in a very high dosage daily is I think it's not the right thing to do. You should take finasteride, yes, at the most once a week, say on Saturdays. You can take 0.5 milligram Dutasteride at night in place of that day's dose for finasteride. That's the maximum. I do not recommend this to my patients because, see, this is not, Dutasteride is not FDA approved for hair loss.
Yes, that's true. Okay, sir. So, should I be starting Dutasteride that weekly dosage by now, or should I give at least finasteride a year and then after that we should go to the Dutasteride?
See, there is no harm in taking finasteride 6 days a week and Dutasteride straight away 0.5 milligram once a week, because clearly you have diffuse pattern alopecia.
Okay, so fine. So I should be starting with Dutasteride at least a week.
Discuss that with your doctor, and I'm sure he will advise you to do the same thing.
I have, sir, but they are quite adamant about me stopping the finasteride completely and going on Dutasteride 0.5 mg a day.
So probably then he might have been alarmed, because he might have thought that you were a case of diffuse pattern alopecia, and probably you will not respond to weak DHT blocker, and probably since you've got a hair transplant done, because grafts are precious, he probably told you as a last ditch effort to start on a more potent DHT blocker.
Okay, I understand that, but I should not be doing that. Maybe I can go with starting with Dutasteride at least once a week, and then after that we can move forward.
Yeah, you can do that. Discuss it with your doctor.
All right. Oh yes, please. Will do. Okay. Another thing is, sir, about Minoxidil. So doing 5% topical. That's once a day. Now, after also seeing this, as you're saying, yes, it seems like they have been alarmed and they have informed me to go on 10%, which is twice a day, and 5% like in the morning and 10% in the night.
Okay, so after 5%, higher concentrations than 5%, has a similar dose response curve as 5%. There's no point taking minoxidil 10%. It will only cause headaches and irritability and mood changes. Changes it will cause. And minoxidil can be easily applied once a day because it has a long half-life. But better still, because we have to salvage the situation, seeing that your doctor is alarmed, because he would know the best. So taking a cue from his latest advice to you, I will say that yes, you should also be concerned and you should go on to minoxidil 2.5 milligram tablet taken orally at night every day.
Okay, so right now we are in topical, and speaking of oral, they have advised against oral. They are not very much big a fan of oral.
Okay.
So they are still going for topical here, 10%, not for the oral.
10% is of no use. There's no additional benefit.
Yes.
Only side effects above 5%.
Oh, okay. I'll have a word again with them regarding the oral. Okay. Another thing, sir, is Dermaroller necessary after hair transplant?
No, Dermaroller is not necessary after hair transplant. You are taking minoxidil, that is good enough.
Yes, that is true, because I believe the only role they have is to make better punches so the minoxidil will be absorbed better. I think so. That's what they do.
No. Primary benefit of Dermaroller is that it causes micro wounds in the scalp, which when they heal, inflammation starts. And during the inflammatory process or the healing process of the body, certain growth factors, healing factors are released from the bloodstream. And these growth factors also cause growth of the hair.
All right. Okay. So, but I'm also not very comfortable because I think I might be doing enough harm than good, because I don't want to take that chance that I'm doing it wrong. It is a scarring, it is a hair breakage, so I'm not very comfortable doing that. Maybe I should just leave the Dermaroller and go with the regular minoxidil.
I would say take Dutasteride once a week, continue Finasteride, and start yourself on oral minoxidil 2.5 milligram at night. If the aim is to salvage a situation which the doctor thinks is not what he expects. But still, I would like to underline the fact that at 4 months, it's just the early stage. You shouldn't be so alarmed, unless you have alarmed your doctor.
I don't know. I'm only been sending him pictures as regular. I have just sent you my pictures. That's all it is. I'm just sending pictures. That's all. Okay, so sir, should I leave Dermaroller, because that's been also suggested to me now, and I'm not sure about if I should be doing that.
No point.
Is it necessary?
There's no point doing Dermaroller as long as you're taking Finasteride, you're taking minoxidil, especially because it's just 4 months.
Yes, sir, that is true. Okay. Now there is a scar in the front, if you will notice. The scar.
Yeah, I was wondering what that scar is. It's a pink scar.
Yes, sir.
Yeah.
Okay, so what happened? It was an accident. I will send pictures I did not send before. So after the scabs removal in the early days, so I went to the clinic and they removed the scabs, and there were a little bit scabs that were not being removed by them. So I was being said that they will be going off completely on their own. I was like, fine. Then coming back to home, I was doing a regular Johnson baby shower with very light sterilization, but just like that area just fell off. And after falling off, there was a slight bleeding from there. I'll share the pictures. After that, the hair did grow in that location, but then it was the shedding. After that, it did not ever recover after that.
Can you send me the pictures of that area?
I have just sent a picture of the other number.
Either it is an infection, more likely an infection, but it could be also limited scalp necrosis. Was the crust which came out, can you show me the picture of the crust? If it was black.
It was black. I do not have the picture.
So
I will show you the picture, exactly how it was.
Please send me the picture. Because if it was black, then it is skin necrosis. If it wasn't black and the color of this grayish color of crusts, then it was just crust covering a localized area of infection. Was the pus came out or blood came out?
Okay, sir, I've sent you the pictures. So this is after the crust have been removed from the clinic. And you can see there's a small dot in the...
Yeah, these are general areas of scalp necrosis.
Okay.
Clearly, yes.
What is that exactly, sir? Okay.
Scalp necrosis is when localized areas of scalp necrose, the skin dies off. So there is an eschar formation. Eschar means dead skin, okay, which is deep.
Okay.
It is deep. Then when it heals with a scar, and in that area hair will not grow.
All right. So can I do a future FUE there if it's possible?
For an FUE procedure to be done I'm a plastic surgeon. For an FUE procedure to be done or any intervention surgical to be done in a previous scar, you have to wait for a minimum of 1.5 years, or the scar becomes pale, loses its pinkish color, whichever is earlier.
Yes. Okay. I'll do that, sir. Okay. Now I'm also having very few, not much. Something is known as, I don't know how exactly to pronounce it. I believe it's follitis, something like that, which is like a pimple that goes over the scalp. So I'm having like few dots here and there, but it goes away on its own. I'm not applying any ointment over them like Fubitate or anything.
Okay.
Is there a need for me to apply any ointment, because I believe they're going on their own?
Yeah, there are certain infection areas of small infection, but this is because of small areas, many areas of localized necrosis, so there's infection underneath. So I would say that you go on a 7 days course of oral antibiotic, and over these areas you apply T-Bact ointment, that is imipurocin ointment. I will send it to you in writing.
Sure, sir. Okay, I was also suggested another form of, which is just now in the 5th month. I'm not sure why it was suggested to me. It is, I believe, Clobate. Clobate was suggested to me to apply.
Okay, please don't apply Clobate, because Clobate is a steroid cream and steroids delay healing.
Okay.
Has the doctor seen your pictures?
Yes, they have only seen my pictures, and I haven't went there in 3 months in the clinic. They have not suggested me. The conversation is only over the phone.
Do you reside away from your doctor or in the same town as your doctor?
Same town as the doctor.
So I think you should go and check out with the doctor, because what pictures you're sending, probably they could not comprehend what it is, or probably somebody else is seeing the pictures and advising in a routine manner, because yours is not a routine case. This is a clear-cut case of localized scalp necrosis.
All right. Yeah, that's also, but I have been asking them if I can come to visit, but they ever said that's no need to come to the visit.
But you should go and visit him. Another thing I would like to ask you is whether you are a diabetic, number one. And number two, do you have any other skin problem or immunological problem?
Okay, so before the transplant, there was a test done. I cannot actually maintain a routine to be on a fasting for 9 hours and then go to a blood check. So I had a random sugar check, not the regular one.
No, what you do is
random sugar.
No, that's okay. It doesn't matter. Can you get your HbA1c level tested? For that you don't have to be fasting.
HbA1c, yes, I'm checking it. Okay, I'll have it checked. That's about the diabetes.
Because could be that you are a diabetic or a pre-diabetic borderline, or you have an underlying skin condition which was not detected or could not be detected. So, but I think you should, besides these problems which need to be addressed, you should wait for at least 6 months for passing a judgment on your hair transplant result, making any opinion out of it.
Yes, sir. I will. And I will also get that check for HB1AC. That was it. And about the underlying skin issues, I do not know, officer. I do not know if I have a skin issue.
Yeah, it doesn't seem to be. It doesn't seem to be, because your skin is clear in the pre-operative pictures.
All right. Okay. And regarding the donor, I'll have to check if it's a shock loss or if it's over-harvested. So I'll also have to wait and check on that. So.
Yeah, it could not be over-harvested, because I have seen the pictures of the FUE zone of FUE, which is 1 inch above and 1 inch below the FUT scar. The shock losses happen in other areas. I think this could be because you're a case of diffuse pattern alopecia. In such cases, when you harvest, the donor area goes into a shock.
All right, I'll wait for that. Now, also, sir, right now when I'm doing Minoxidil, a few hairs, I'll send you the pictures, a very few hairs do come in my finger, like strands. A little bit of strands.
All right.
So should I be worried about them? Because, okay, so when I run my hand through the donor area, it's fine. I do not get any hair fall. But if I will apply something like, because I'm doing the oil in the transplanted region, a little bit of coconut oil or maybe minoxidil, the moment I start to spread it around the skin, the minoxidil over the transplanted region, I will get few small hair strands on my fingers.
But the concerns are different. That we'll have to wait for 6 months to decide what it is. It might all grow back.
Okay, so Okay, all right, sir. Okay, so as of now, what should be mainly doing is take Dutasteride at least once a week to
Yeah,
start.
so I'll just give you a summary of what we've discussed. We've discussed that you should be on medication, which is Finasteride 6 days a week, Sunday to Friday, 1 milligram at night. Take Dutasteride 0.5 milligram at night on Saturday nights. Okay. Besides that, do not take 10% Minoxidil. I would advise you to switch from 5% Minoxidil or 10% Minoxidil to 2.5 milligram oral Minoxidil, but in consultation with your doctor, because he knows your original condition and your health condition. Because you need to have a strong heart and strong lungs to take such medicines that affect the heart. And besides that, for your scalp necrosis, you should take an antibiotic for 7 days, oral antibiotic. And topical antibiotic or antibiotic cream you can apply is mupirocin ointment.
Yes, sir, that I believe would be all for now, sir.
Okay, thank you. Nice talking to you.
Thank you, sir.
Bye-bye.
So thank you for watching again. If you have any questions about this patient, if you have any questions about hair loss medication for men and women, about hair transplants, the side effects of hair transplant, about hair transplant correction, hair transplant repair, hair transplant revision, or any other question that comes to your mind, let me know in the comment section below and I'll be there to help you. Have a nice day and God bless you.